Hi everyone. Today I want to talk to you about type 2 diabetes. I want to talk about the anatomy of type 2 diabetes, so talk about the different key players involved. I want to talk about some treatment options for type 2 diabetes, and I also want to talk about the long-term effects of type 2 diabetes, particularly what happens if you don't control the disease state and treat it properly. This video would be perfect for those who are either studying the disease state in school, or those who were recently diagnosed with type 2 diabetes, or you have a friend or family member diagnosed, just so that you understand the basics of the disease state. Now let's discuss some of the key players involved in diabetes. As you can see from this picture, you have the pancreas here, and it is an organ found within your abdomen. As you can see, it's close to your intestines, and what it does is it produces hormones. If you look in this little zoomed in section here, you'll see what's called a pancreatic islet, also known as an islet of Langerhans. And within that islet, you have some specialized cells. You can see you have alpha cells, which are much more important in type 1 diabetes. So I'm going to kind of brush over it real quick. Alpha cells produce a hormone called glucagon. And what glucagon does is it increases the glucose in your bloodstream, or it increases your blood sugar levels. It's much more important in type 1 diabetes than type 2 diabetes. More important for type 2 diabetes are the beta cells. And what beta cells do is they produce a hormone known as insulin. So you've probably heard of insulin before, but why is it so important? If you look at this picture, you'll see why. So every cell within your body will have what's called an insulin receptor. And so when insulin is released from the pancreas, it finds its way to all the cells within your body and attaches to an insulin receptor. When that insulin receptor is activated, that opens up a glucose transporter on another section of the cell, which allows glucose to be transported into the cell. Now, why is it so important to have glucose in the cell? If you think back to some of your earliest biology classes that you may have taken, you may remember that glucose is necessary to produce ATP. And if you remember, ATP is the main source of energy for almost every single cell in your body. Without ATP, your cell has no energy, and without any stored energy, eventually every single cell will die. So let's review a couple of things real quick. Whenever I say glucose, I essentially mean blood sugar or blood glucose. Those are pretty interchangeable, and you'll hear people call them both as you potentially talk to your doctor about this. Remember that insulin moves glucose into the cells, and that glucose is necessary in those cells in order to produce ATP. And just remember that ATP is a cell's way of storing energy and is necessary for that cell to live and do everything that that cell is intended to do. So let's discuss what goes wrong in this system in order to cause type 2 diabetes. What happens is an unfortunate feedback loop or unfortunate cycle of cells becoming resistant to insulin. And essentially what that means is that the cells will require a higher amount of insulin in order to open those glucose transport channels. So the pancreas responds through those beta cells producing more insulin. So that meets the demands for a short amount of time until those cells require even more insulin to open up those channels. And so it's this cycle of requiring more and more insulin until eventually those beta cells stop producing insulin and die. Now, as this cycle is going on, if a patient is at the point that they are resistant to insulin and requiring more insulin to get glucose into the cell, but they haven't reached that point of the beta cells stopping insulin production and dying off, they may be labeled as what's called pre-diabetic. Or essentially, if the cycle continues, they will go into type 2 diabetes. It's at this point that if a person changes their diet and their exercise, decreases their intake of sugar and carbohydrates, and increases the amount of exercise they do every day, they can potentially prevent that beta cell destruction or beta cells from dying for years or sometimes even decades. So I would highly recommend that if you get diagnosed with prediabetes, that you immediately make some lifestyle changes in order to prevent you being diagnosed with type 2 diabetes. Now, not every single beta cell is going to die off and stop production of insulin. You'll still have some beta cells that are producing insulin, just not as much as you were prior, and because of that, your blood glucose level is going to start to go much higher than we like to see. Now let's talk about some of the ways that your body will compensate for that high blood sugar. One of the ways is what's known as polyuria, or essentially increased urination. Since a type 2 diabetic isn't producing enough insulin, the body is unable to get that glucose into the cells, and so it needs to do something with that glucose. And so what it does is it forces it into the bladder, which then it can be urinated out. Centuries ago, this was actually how physicians diagnosed diabetes, was they would taste the urine because it had a ton of sugar in it, so it was sweet, and they would diagnose them with diabetes. There are some risks, though, that go along with having an increase in glucose in your urinary tract. The first being that with that increase in glucose in your urinary tract, that would put you at a higher risk for a urinary tract infection, or a UTI. The next is that since the body is pushing that glucose out of the blood into the bladder so that it can be urinated out, water is going to follow with that sugar, which means that you need to replace that water, which is known as polydipsia, or essentially an increase in thirst, which causes you to drink more, which causes you to urinate more. Now let's discuss some of the treatment options for type 2 diabetes. First and foremost, it's always going to be diet and exercise is your first go-to option for treating diabetes. First, let's discuss how diet can help with type 2 diabetes. If you decrease your intake of sugar and carbs, which carbs are just broken down into sugar, that's going to decrease the amount of blood glucose that you're going to have, which is in turn going to decrease the amount of insulin that your pancreas is going to need to produce. Exercise is going to help by burning up some of the glucose found within your bloodstream, as well as it's really healthy for your heart to exercise on a regular basis. Together, diet and exercise are going to help a type 2 diabetes patient lose weight. With everything that I've discussed, hopefully this is all starting to click together. So if you lose weight, you're going to decrease the amount of cells within your body because you're burning up those fat cells and killing them. And that is going to decrease the amount of insulin that is going to be needed to be released by your pancreas. With a decrease in a patient's insulin requirements, that can help prevent further burnout of those beta cells within the pancreas. Now let's talk about some of the medications that are used to treat type 2 diabetes. The most common medication that you see prescribed in a newly diagnosed type 2 diabetic is metformin. Metformin works in a couple of different ways. The first being that it decreases absorption of glucose. If you decrease the absorption of glucose, that's going to decrease the amount of glucose in the bloodstream, and that in turn is going to decrease the demand for insulin from the pancreas. Metformin also decreases insulin resistance. If you remember back to the beginning of this video talking about insulin resistance, that as insulin resistance goes up, it requires more insulin in order to get glucose into the cell. Well, if we decrease that resistance, we're going to require less insulin in order to get glucose into the cells. Another commonly prescribed medication that you'll see in newly diagnosed type 2 diabetics are sulfonylureas. Now, how sulfonylureas work are they help to stimulate insulin release from those beta cells. When a patient is first diagnosed with type 2 diabetes, they still have a large percentage of their beta cells producing insulin. As time goes on, their beta cells will start to burn out and they don't produce as much insulin, making this drug not useful in that patient population because they no longer have beta cells to stimulate in order to produce more insulin. So you'll see this drug given when a patient is first diagnosed with diabetes, and then as time goes on, a couple of years, maybe 5-10 years down the road, they'll no longer be on a sulfonylurea drug. So I keep talking about insulin, so why not just give a type 2 diabetic insulin? It's definitely an option. There are two different types of insulin. There is basal insulin or long-acting insulin, and this is an insulin that you give usually once, sometimes twice a day. It's a set amount, and that's based upon your current pancreas production of insulin. The other type of insulin is what's called bolus insulin, or essentially fast-acting insulin. This insulin is dosed based on the patient's intake of sugar and carbs, and it's to help prevent spikes in blood sugar and help level out that patient's blood sugar level. Some things to remember with insulin is that we need to be careful on the dosing of it. Remember that it's much easier to deal with a high blood sugar level than a low blood sugar level. If a patient's blood sugar goes too low, which can happen from giving too high a dose of insulin, the patient will go into a coma and eventually they can die from it. Now, typically, insulin is reserved for either patients who are newly diagnosed to help get their blood sugars under control, and as they make lifestyle changes through diet and exercise, they may no longer need to be on insulin. And it's for patients who no longer are producing very much insulin on their own. So let's talk about some of the long-term effects of not treating diabetes. The majority of the effects from diabetes on the human body occur from what's called small vasculature damage. To understand how this occurs, you need to understand and know that molecules do not like being concentrated. They always seek to be in a lower concentration and to spread out from other like molecules. It's the exact thing that's going on with glucose within the bloodstream. And so because an untreated diabetic will have a high blood sugar content, that glucose is going to try to get to an area where it will be in a lower concentration. So it does that, for example, as I explained earlier, it can go into the bladder where it's a lower concentration and can be urinated out. Or what glucose can do is it can technically change shape. And it's no longer technically glucose, even though it's the same atoms, they're just in a different shape. And when glucose does that, you can almost think of it like it's getting sharp and it starts to cause damage to cells. So it will bind to cells and it can damage cells and potentially even kill cells when it does that. So I have a list here of some areas throughout the body where there's small vasculature that gets damaged if you don't treat your diabetes. So kidney disease, within the kidneys there's very small little vasculature that can easily get damaged. In the heart, same thing. Neuropathy is in your fingertips and your toes and your feet where there's very small vasculature. That glucose can cause damage to the nerve endings there, which then can cause numbing and tingling and loss of sensation within the fingertips, the toes, any extremity. As well as erectile dysfunction and visual changes can all occur if type 2 diabetes goes untreated. Do keep in mind, I'm giving you all of this information, but if a type 2 diabetic properly controls their diabetes, there's a very good chance that they could prevent any of that from happening and live a normal life as long as they properly diet and exercise and take the medications that their doctor has prescribed them. So with that, I'm going to wrap up this video about type 2 diabetes. I hope that you enjoyed it and that you learned something from it. Please let me know in the comments if there's any other topics that you would like me to go more in depth on, or any other videos that you would like me to make. Please like my videos and subscribe, and hopefully this was helpful, and thanks for watching.